I am so grateful to have the opportunity to introduce to you my colleague and friend, Dr. Sharon Goldfarb. Um, it, you know, I think I can sum it up is she's involved in just about everything that could possibly improve the quality of healthcare. She is a nurse practitioner, and I see her often on This Is Our Shot, which is about, the vaccination mission that we're all on. She's involved in, she's an adjunct faculty at Touro University, her alma mater. She's a consultant with Health Impact, which is the workforce center in California, and also a consultant to Osmosis. Sharon, I'm sure that doesn't have anything to do with the osmosis that we learned in nursing school. You want to tell them what osmosis does, just to give a little plug?
Well, I mean, I just want to tell you the background that I was the president of California Organization of Associate Degree Nursing through the pandemic, which was not an easy thing to do, to come up with solutions like tele nursing and returning safely for critical skills. And as I was working myself really to the point of utter exhaustion on a daily basis, I ended up winning the award of best faculty in the country of all health sciences from Osmosis, which I knew some of my students were using, but I didn't know exactly what it was. And as I decided to transition out of full-time academia, I said to Osmosis, hey, if you like me so much, why don't you hire me? And they have. So go for what you think will be good. And it's been a really exciting opportunity. Osmosis grew out of Khan Academy. The health science team
Mhm.
of Khan Academy basically launched their own platform, starting out for medical students and now expanding to other health sciences. And they have over 2 million subscribers and it's around the world. So I'm helping develop nursing curriculum, for the world. And I really like to bring to it the vision I have for the future of the nursing workforce, not just where nursing is or where we have been, but where we need to go. And so that's where I was up until coming here. I was at osmosis meetings, but I've been really enjoying that work. And if you're ready, I'll jump in.
I was going to say, take it away we want to go on some social mission trip here.
Right. So today I'm going to talk about social mission. And if you haven't heard of it, don't be surprised until I sort of got pulled in. I hadn't heard of it either. But as we know, there's a lot of discussion now with the Future of Nursing report that we want to move towards health equity. We want to really look at systems of structures of racism, implicit bias, and how can we improve the healthcare to our patient population, our communities, their families, and how do we do better in nursing too? And a lot of times it's a lot of great discussion, but how do we actually do it? And I think what's great about social mission, it actually gives us some ideas of what to do about it. So I'm going to kind of tell you what social mission is. And here is our objectives today. Are you seeing the slides as I'm going through them? Okay, I'm going to tell you a little bit about the history of social mission because my first degree was a bachelor's in history. I love history, and then kind of understand the relevance of today, and then really like use the chat button, or we're so small, just unmute and talk about maybe how you're using it, where you are, or where you think you could use it. So that's what I'm hoping we come away with, that we're energized and ready to take on this work. Um, so what is social mission and nursing education? Why are we even talking about that? So we know the American Association of Colleges of Nursing has really said that there's a concern that nursing schools are not placing enough emphasis on human rights advocacy. The Future of Nursing report, of course, emphasized health equity as a focus for both education and practice. And really, social mission is what is going to prepare our future nurses for the needs of a very diverse patient population and working towards achieve health equity. And now I could spend a lot of time talking about that. Yes, America is getting more diverse by the minute, by the day, and that we really have some poor health outcomes, especially when we're talking about under-resourced populations, whether you're talking about um, African Americans, Native American or Indian populations, Latinx populations, or people with economic challenges, people who come to, undocumented workers. There are a lot of populations that really need sort of the resources and the help that we don't traditionally like look at that. So I see someone needs to be admitted, and let me do that. But then I moved my slides. Okay, so more admissions. Okay, so if you're not aware of the Flexner report, it's really just important to know that because this is Albert Flexner who wrote the Flexner report, and it was research done in 1910 that evaluated medical education. And what it wanted to do was have a more rigorous and standardized education. Prior to that, there were a lot of things that were calling themselves medical schools that maybe were not so how we see medical schools today. So they increased standards for admissions and standards for graduation, but there was, the other side to it and the backlash that we're sort of living with today. When the Flexner report came out, the majority of Black medical programs actually closed, and these structural racism of like what makes a good student, sort of persists today, and so that's why you see a lot of inequality in medical education. And I went to one conference, and California, where I'm from, has more Native American people than any other state in the country, but currently they have one Native American medical student. So when you see things like that, you have to kind of look to the history of Flexner and why that's happening. So let's see. So along comes Fitzhugh Mullen. And if you haven't heard of him, I didn't hear of him either until I got involved. And I was very honored to meet him just prior to when he passed away. But he's an he was an amazing physician. And he did write an autobiography that I read and enjoyed thoroughly called White Coat, Clenched Fist. You can describe him as a humanitarian, a physician, an educator, a social activist. He wrote many books, including his own struggle with cancer. He was a professor of health policy and pediatrics at George Washington University. He was involved in the US Public Health Service for most of his career. He's really the father of social mission and the founder and board chair of Beyond Flexner. So we just saw about Flexner, and now how do we go beyond Flexner? And I think what was really amazing about this man was before he started medical school, he actually went down south to work on the civil rights movement. And it really changed the way he saw the world, being in the Deep South and seeing the poverty and the discrepancies there. And it really colored what choices he made in his profession and kind of fighting. He always fought for equality. And the George Washington Institute that started it has been renamed the Fitzhugh Mullen Institute. And if you haven't been to their webpage, it's a great place to go and really see what's going on. So what happened with Beyond Flexner was they looked at the Flexner report and they said, like, maybe we need a different rubric of how we look at medical schools, which has eventually trickled down to other health sciences, including nursing. And instead of looking at like, your GPA in biology and, how smart students are and how rigorous the program is, you actually bring in social mission. You look at things like, is the curriculum diverse? Are you meeting your community's needs? Are students graduating and going into areas with most needs? Is there diversity in faculty and students? When you look at this rubric as opposed to the Flexner rubric, schools all of a sudden reshuffle in a really different way. So under Flexner's rubric, a school like Harvard does very, very well, and a school like Howard does very not so well. But when you look at it through the Beyond Flexner, the social mission metrics, all of a sudden Howard does really well and Harvard does not do very well. So I'm not saying you have to be one or the other, that I think there's probably some happy middle spot, but I tend to kind of go to Flexner because I'm all about health equity. And again, feel free to jump in with questions at any time. Um, so what do we say about social mission? The social mission of health profession schools is the contribution of the schools to its missions, programs, and the performance of its graduates, faculty, and leadership in advancing health equity. That's the important point. Are we advancing health equity and addressing the health disparities of the society in which it exists? And I think we could talk all day long about all the health disparities we're really thinking about these days, infant mortality, maternal mortality, pain management, correct diagnoses, treatment interventions. And we're really falling short of the mark But if we focus on advancing health equity and addressing the health disparities, if we use this kind of social mission metric to how we engage our students, how we recruit our students, how we keep our students involved, the faculty and the work they do, we really can, nursing can be an important part of where healthcare is going. So, the person who's really doing a lot of this work, and it's really her research is Dr. Ashley Darcy Mahoney. So I'm going to be talking a little bit of her work. So what she basically says is the ability to achieve one's highest level of health depends on myriad of social constraints, or what we sometimes call the social determinants of health, right? That your zip code has so much more to do with your health than your genetic code. And a lot of people are having a hard time really understanding that concept, or they want to think personal choice has a lot to do with health and not really the what's going on in society. But there's really a lot of social constraints on how well people do. And just to give you an example of that, I had a patient come in when the fires were very bad. I work at a clinic with undocumented and uninsured people, and her asthma was terrible, and I gave her a treatment, and I sent her home with some multi-dose inhalers. But I said, if it gets bad, you really need to go back to the hospital. This clinic is only open 2 half days a week. And she burst into tears and she goes, I am never going to the emergency room again. The last time I went there, they wrote me a prescription for a medicine I couldn't afford and sent me a bill for $10,000. They did nothing for me, and I'm trying to pay off this $10,000 loan as someone who stocks, a warehouse. And it just really breaks my heart that someone who could be facing a life or death situation would choose not to go to the hospital because of their experience. So the other thing about healthcare disparities are that the racial or ethnic, and I would even say economic differences in quality of healthcare that are not due to access related factors or clinical needs, preferences, or appropriateness of intervention. And we really know that nursing students must be taught ways to help patients with considerations of health disparities that go beyond just meeting the needs of their patients at point of care. So if you are in a hospital and you're seeing lots and lots of people who have end-stage kidney disease because of diabetes, what's your community like? Is it a food desert? Like you have to look at the situation that has led to where people end up in tertiary care. Okay. So where do we go from here? The solution is that nursing schools need to educate faculty on social mission to be better equipped. And as I go on, I'm going to give you some exemplars of what some schools are doing. We need to be better equipped to discuss and address biases in healthcare, including in our own nursing programs themselves. I was in one nursing school where we were talking about having a more diverse nursing student body, having a diverse nursing faculty representation. And when it came time to have a hiring committee, the hiring committee was all white. So where are these structures that kind of keep keep things status quo, and where do we need to move and how to do it? So we need our professors, instructors should engage in related discussions in classroom settings. Like I basically don't give any lecture without looking at kind of the social mission metrics. If I'm talking about asthma, and I'm not talking about how asthma affects poorer communities where there's more air pollution, fewer green spaces, more rats and roaches and pesticides, and those kids are having higher rates of asthma, I'm not really giving my students the whole picture. And we really want to focus on justice, inclusion, engagement, and diversity when we're doing this work. So a nursing workforce that embraces the principles of social mission is better equipped for providing care that promotes wellness, prevents illness, restores health, and enhances the quality of life in a way that is appropriate for all individuals, families, and communities. Like this is just so key. What we teach our students, where our students do clinical, our values, and where healthcare needs to go has to be part of the equation. So right now, the majority of nursing schools focus on tertiary care facilities, right? And what's happening is only 49% of the RN workforce is going to land in hospitals. And that's a number that's actually decreasing. 51% of the workforce is landing in community health, whether it's in school-based clinics, whether it's in a community health center, whether it's in the Department of Health, whether it's in a hospice setting. And that is really where people need the best healthcare and where more and more of it is landing. So tertiary care is kind of where things are most expensive. So like I said before, if you're looking at someone with end-stage renal disease who's getting a lot of dialysis, that's much more expensive than if you had been at a school-based health clinic and got your students to eat healthier early on, right? Or had a school garden and taught kids about growing and healthy eating. There's a real lack of emphasis on social mission in community health settings. There's a newer shift towards public health and changing healthcare systems and an emphasis on prevention, early detection, management rather than acute care. So not only should we be teaching this, we should be teaching this because this is where, healthcare needs to go. So we have to be, there's the Wayne Gretzky quote about a good hockey player plays where the puck is, and a great hockey player plays where the puck is going. Well, we have to be great hockey players as nurse educators. We've got to see where it's going. This is where the research has to be, and this is where our students have to be focused. So what is the social mission in nursing education? It's that we do a community needs assessment right off the bat. And if you don't know how to do that, I'm happy to share my information and talk you through that process. But in a nutshell, most hospitals have a community health fund. They do community health reports. Often hospitals in an area will get together and do that. You can go and look at zip codes for a lifespan. You can kind of look at leapfrog. What are the things facing hospitals? So there are a lot of resources out there where you can say, this is where my students need to be to kind of meet my community health assessments. I think nursing schools have to engage with their community-based care, not just their hospitals, but their local Department of Health, their school-based clinics, their community health organizations, if they're jails or prisons or correctional facilities around you, they all have healthcare systems. Like, where is health being met? And I mean, now it's being done at the local pharmacy. It's all over the place, mobile medical vans. So you should know where it is and see where your students can kind of be aware of these resources and maybe actually work, or your faculty can work there too. So we want to expand our clinical sites to community health centers. We want to restructure curricula to emphasize social determinants of health. I also really like the ACEs, which is the adverse childhood experiences, as a screening tool. When you look at that, that really affects health outcomes. We want to shift to population health perspective. We're looking for more training and outreach efforts, emphasize primary care and prevention, and you got to get politically active, because there's also the piece of, that some of the structures and the politics are leading to these problems or preventing solutions. So I could do a whole lecture just on the political activism. So tracking social mission, you're here for research, so I'm going to give you a little research. So the research done on social mission was to basically look at these categories: the educational programs, their community engagement, their governance, like shared governance, how much diversity and inclusion in their faculty, in their students, and the institutional culture and climate and the research they were doing. These are the metrics for kind of judging social mission. And sorry, why aren't you going forward? Okay, here. So here is how things initially started with social mission, these buckets that I talked about before, and kind of going into, a little more detail about this, and basically when they first did the survey, they looked at dental schools, medical schools, and nursing schools, a total of 9 dental programs, 27 medical schools, 24 nursing schools, and they were mostly at the BSN MSN level. So a total of 60 schools around the discipline to look at social metric. And then they decided they really wanted to drill down a little more into the nursing program. So what they did is they scored based on this sort of metric of social missions. They sent additional surveys to stakeholders and they scored based on these questions, and these scores were all confidential. But there were some takeaway lessons from this research, and I'm just going to give you some of the exemplars and why they were exemplars. So one of the schools they looked at was Rush University in Chicago, and what they found is that Rush really exemplifies their community partnerships. They have 30 formal community partnerships that focus on the nonprofit and the social service world. Their students are involved in clinical settings with these 30 community partnerships. Florida International University is a Hispanic serving institution, or HSI. 45% of their students and 40% of their faculty identify as Latinx. 34% of their students and 17% of their faculty identify as Black. And how do they kind of support this very diverse program is they have a holistic admission, which I highly recommend, because I've often said that, it's easy to get a student who's had straight A's in all the sciences to be in my nursing program when they come from family wealth. They've gone to the best private schools. They've always had tutors, but maybe I want a student who has B's who works full time and is a single parent. Maybe that is a way to look at how we admit students. And that's the kind of gist of holistic admissions. They are very flexible about clinicals because they understand their students need to work. So they're evening and weekend clinicals to support their students' need for work. And they have very formal and informal celebrations of diversity. They have potlucks, and they feel like a place where people's identities are celebrated and recognized. Another exemplar was the Elkhorn Community College, which is a historical Black college. And one of the things is that it's in a rural area. A lot of the students come from farms. It means that they don't always have access to Wi-Fi. So they make sure all their students have Wi-Fi. They give their students Wi-Fi hotspots. They have a robust alumni supported emergency fund. So when students are in trouble, they know that there's financial help for them and there's plenty of money for that. And they really recognize neurodiversity and resources for learning differences. I think, we have to realize that our students come to us with a lot of different learning styles and a lot of different learning needs, whether it's something really formal like, dyslexia or attention deficit disorder, or, maybe just need some extra help because they didn't go to the best schools or have the best resources or they're first generation. And I think when you give students the tools they need, you will see students really excel. And I like to talk about my own experience at one of my community colleges is that when I started there, we had a 27% attrition rate. And at the same time, we had about a 79% NCLEX pass rate. And I really hated seeing my students flunking out when my first semester there. And I noticed that the students who were flunking out were all students of color. So I looked at what was in place, and it was sort of a punitive remediation model. You're on academic probation, you have to do this and that, and we're watching you. We don't know that you have the stuff. And instead, I switched it to an individual student success plan. When I did that, I ended up having a 3% attrition rate and happily 100% NCLEX pass rate. So you have to really be visionary about where you want things to go. And I see that Deb has asked a question, but maybe I'll save it to the end. So Santa Fe Community College, they've really created a home-like atmosphere. And I love that because we know from the neuroscience of learning that students learn the best when they feel connection, when they have oxytocin, when they like their instructors, they work harder, when they like their classmates, and there's a sense of community. So Santa Fe Community College really does that. They have free hot lunch, they have a food bank on site, and they really pipeline from their local high school and their local LPN or LVN programs. And I think pipeline is a great way to go. I think a lot of students don't really know what they're capable of, and part of what we do is kind of support a stronger vision of where they can go. And then the other exemplar is UCSF. I'm on faculty at UCSF, just to do the disclaimer, and they really prioritize social mission research, and social mission metrics are an important factor on faculty promotion. So, Whether you're a school with a lot of money or a school with a little bit of money, there's something for everyone in social mission. And so the future plan of this work is to keep on sending out some surveys to standardize the metric system and keep on looking at these programs every 3 to 5 years to track the progress. This is a big undertaking and we all have to sort of get involved. And I think the work at George Washington has been really amazing. So, I just want you to know that nursing is a reflection of the society in which we live. Socioeconomic divides of racism, sexism, homophobia is an important thing to look at. The society influences the way nurses collaborate with each other and our healthcare team, and the societal lens influences how nurses interact with their patients. So if we kind of make our students really just look at tertiary care with patients who have the best insurance and can afford the best hospitals, we're really only getting the tip of the iceberg there. And I think it's interesting. Here's a picture of kind of the earliest of community health nurses, that the early days of nursing really looked at this and really met the needs of people who through settlement house work. And that was visionary and it's still visionary if we engage in that. So I'm really curious about what your school is doing. If you want to unmute or put something in the chat box, I want to give you a little bit of the citations that I used for today's presentation. And, again, welcome your questions and comments and feel free to stay in touch with me. And I'm going to read what Deb wrote. She said, great presentation, so thank you so much. Admission standards need to be reduced. We need to cast a wide net. We also need to get away from traditional linear curriculum structure, move towards integrated curriculum structure, which supports learning, especially those students from underserved populations. And I really couldn't agree more with you, Deb. Thank you for that comment. But I think when you're looking for what makes a good nurse, realize there are a lot of ways to be a nurse, right? There are the research nurses, there are the bedside nurses, there are the nurses who work at the IV, at the methadone maintenance centers. There are the nurses who are great with death and dying. There are the great nurses who are great with administration. And so we have to throw that wide net to get a lot of different nursing students into the mix.